If you feel regular buckling or giving out of your knee, could you have a serious knee injury like an ACL tear? I discuss the possibilities in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of the Ask the Doctor video series based on questions you've left me in the comments of the videos on my channel. Here's the question. About once a week, my knee buckles and gives out. I momentarily lose balance. Is this an ACL tear? As always, quick disclaimer, I'm not giving medical advice in this video or any of my videos. This is meant for general information and educational purposes only. Now, the answer is a simple maybe, and here's what I mean. If you had a traumatic event where you landed awkwardly from a jump and your knee just exploded, or you were running, planted your foot, changed directions, and you felt a huge pop in your knee, yes, that could be an ACL tear. That's the ligament in the center of your knee. And the problem with an ACL tear, and why almost everybody needs surgery, is that your knee is no longer stable. It tends to shift out of place when you land from a jump or when you change directions. And so you need that ACL reconstruction or augmented ACL repair. There's some new techniques along that line that can restore stability of the knee. But if you didn't have a traumatic injury and just all of a sudden, or even over time, you just started feeling your knee giving out, picture you go hiking, you haven't hiked in months, you hike all day, and now your knee feels weak and it's giving way. That is almost never an ACL tear. ACL tears don't typically happen over time. They are traumatic events. What's typically going on in that second scenario is some other problem is causing subjective instability, a feeling like your knee is giving out. And there's lots of things that can do that. Some cause of knee pain that's causing basically a subjective instability. Swelling of the knee can do that. Muscle fatigue can do that. That's more of a chronic issue. So if there wasn't a traumatic event, it's highly unlikely that that's an ACL tear. Again, those are almost always traumatic. If you're having what feels like instability, and this is happening over and over again, though, I would recommend potentially, again, do what you want. This is not medical advice, but I think it can be a good idea to go see an orthopedic surgeon, maybe get x-rays or even an MRI, depending on sort of the circumstances, but figure out what the underlying issue is that might be causing this sensation of giving way. Now, if you'd like, I wrote an ebook called the Arthritis Solution. If you'd like a copy of that, for free, you can click the link in the description below. Also, if you have an orthopedic injury, you want to hear about options other than surgery and other than cortisone shots, click that same link in the description under this video. It'll take you to a contact form to potentially schedule an appointment with me. I'd also love to hear about your experience with your injury. You can leave those in the comments below. Just understand, if you leave a question in those comments, I can't respond with medical advice, but what I might do is answer your question in a future video like I did here. Make sure to subscribe to this channel, click the bell up there to be notified when I release a new video, and when I start my Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.